Skeletal muscle relaxants. Therapeutic effects of skeletal muscle relaxants or muscle relaxants include basically treating muscle spasms. So muscle spasms are involuntary contractions of muscle. Indications, so for centrally acting include excessive muscle use, injury or stress, so very specifically musculoskeletal injury, sometimes rigidity with Parkinson's, and also musculoskeletal symptoms including multiple sclerosis, cerebral palsy. Sometimes they're also used to treat side effects of some antipsychotic drugs. Direct acting, on the other hand, is used to treat spasticity related to malignant hyperthermia. Precautions and contraindications include care with concurrent use of other drugs causing sedation. One of the most common side effects of muscle relaxants are drowsiness, basically sedation, or sleepiness. So we have to be very careful, especially if we're going to administer it with other medications that will cause sedation. So examples of this is if a patient is on a muscle relaxant and they also take diphenhydramine or Benadryl for their allergies. So that would be something that we have to be very careful. And if there are other alternatives, then we may want to consider giving them a different medication, maybe for their allergies rather than the diphenhydramine or Benadryl. In addition, some other precautions and contraindications, so renal insufficiency with some agents. So we have to be very careful because some of these medications can actually cause increase in renal function, which can eventually lead to insufficiency or failure. Some side effects to consider and to monitor include dizziness, lightheadedness, and sedation. So nursing actions, as always, we have to assess for therapeutic and side effects as well as ensuring safety, especially because if we know that this can affect their level of consciousness, it can cause some sedation, that it's something that we need to be aware about because then again, this patient may be at a higher risk for fall. Maybe we need to educate them to not take these medications if they're planning to drive. Patient education, so drug information, and again, safety issues. Examples of drugs under this class. So we have centrally acting or direct acting. Centrally acting drugs that you have to remember include cyclobenzaprine or Flexeril, baclofen or Lioresal, carisoprodol, or Soma. The most common muscle relaxant that you may actually encounter, especially in the outpatient setting, but even in the clinical setting, in the acute care setting, you may see cyclobenzaprine or Flexeril. So this medication, as I said earlier, this can cause drowsiness and sometimes it can cause patients to wake up feeling like they have a hangover. Another medication is baclofen. It does the same thing, but sometimes for some patients, the sedation side effect is not as prominent in comparison to the cyclobenzaprine. Carisoprodol is another muscle relaxant. Although it is also a muscle relaxant, this is actually highly monitored, and so they're very restrictive when it comes to prescribing this medication because apparently some people tend to abuse this specific drug. So there are times that cyclobenzaprine was ordered and let's say it doesn't work for the patient, then carisoprodol will be a medication to probably consider. But carisoprodol is not usually the primary or first medication that they will prescribe for muscle spasm just because of that risk for abuse. So direct acting, so these are basically drugs that directly affect the muscle fibers, so helps with the relaxation of the muscle fibers. So the one that you have to remember is dantrolene or Dantrium. Dantrolene is used in malignant hyperthermia. So what is malignant hyperthermia? Malignant hyperthermia is a fast rise in body temperature. So sometimes because of that fast rise, it can cause severe muscle contraction. And this is usually genetic and it is secondary or caused by general anesthesia, most specifically propofol.